Good morning. I'm Dr. Mike Detola, the Clinical Director for Dentsply Sirona and the Director of SIROWORLD. And today I have one of our esteemed speakers from the upcoming SIROWORLD 2016 meeting, Dr. Diwakar Kinra. Dr. Kinra, how are you doing this morning?
I'm great. Thanks for having me on today. I really appreciate it.
It's our pleasure. Tell us a little bit about yourself. I know you're going to be speaking for us in the field of endodontics, and I'd like to hear a little bit about your background.
Sure. I grew up in Michigan, and I went to the University of Michigan Dental School. And then I went into private practice for about 3 years as a general dentist. And then I decided to go back to specialize in endodontics in 2002. And I graduated from the University of Detroit Mercy and started my practice from scratch in the great city of Flint, Michigan, which, a lot of people get a little surprised that I would start a practice there, but it's been a great dental community, and I really appreciate it. And I think that I need to bring a little bit of positive news from Flint versus all the negative news that's been lately in the past few years.
Exactly, and doing endodontics, you're taking people, out of pain, obviously. They might even be more grateful for that than they would be in another city. I know at SIROWORLD 2016, you're going to be talking about how to make endodontics more profitable in terms of case selection. Can you give me a few tips or things that you're going to be talking about there?
Sure. I take a look at this from a two different point of view. Now, you're going to have a lot of speakers that are going to talk to you about procedures in endodontics, but I'm going to take this from a more clinical standpoint. So, being in private practice, for the majority of my time in my office, I look at this as two different points of view. Let's take a look at it from the point of view as the patient. The root canal procedure is probably one of the most feared procedures in dentistry. So many dentists take that as a challenge, but I actually look at it as an opportunity because the bar is set so low for root canal therapy. It doesn't take much to get above that bar and please your patients. And so I'm going to take that approach on how to use a flow chart and make good decisions on what root canals are going to make you look like a rock star in your office. Because I say a well-done root canal, your patients are going to use that and as a kind of a thermometer of how they're going to be able to come to your office and be comfortable. And if you can do that and get them out of pain in a very straightforward procedure, I think that will be a practice builder for your office. And I know that many dentists, if they do a good root canal in a single visit, their patients are going to be extremely happy, and their patients are going to return. And they're probably going to go and tell 3 other people that they did a great job. But if you do a bad root canal, they're probably going to go tell 10 other people that you did a bad job. So you'd rather be on the better end of that, and I think it'd be a great practice builder for your office.
Yeah, there's no doubt that in popular culture, the root canal is still kind of the cultural touchstone for pain in the dental office. When you hear something mentioned in root canal and the eyes roll and the people groan like it's going to be awful. So I love your approach of being able to pick cases that are going to make you successful and turn patients into fans rather than tackling something that's maybe outside your skill set that's going to take a long time to do and maybe even lead to a patient who's unhappy and, like you said, is going to tell lots of people about that experience as well. So we look forward to hearing that, hearing your message at SIROWORLD 2016. And I would encourage all attendees who are coming to the meeting to make sure that you catch Dr. Kinra's class. What's the actual name of the breakout that you're going to be given?
It's going to be called Case Selection for Profitability.
That's fantastic because there is something to be said, and I think you'd agree that endodontics is difficult enough where it really behooves us to choose our case as well.
Absolutely, and in the course, we're really going to get into specifics on what's the case that you're going to be able to make money on, what's the case that you're going to break even on, and what's the case that you're going to lose money on. And so I'm going to try to help people get into that category where they're going to be able to select a case that's going to become profitable in their office.
That's perfect. Well, thanks so much, Dr. Kinra. I've enjoyed spending a little time with you, and I look forward to seeing you at the SIROWORLD meeting in Orlando this August.
Thank you so much. I can't wait to see you guys also.